So this is the project video for Mallory Worley, Mallory Hatchett, Allie Yard, and Catherine Phillips. And so what we created ultimately is a postpartum hemorrhaging pan. And so why we came up with this was because we did an interview with my cousin's wife, who's a nurse, who worked in the labor and delivery field. And we were all interested in that kind of area. And so we started to talk with her about what the biggest issue in labor and delivery is. And she said that is ultimately postpartum hemorrhaging in females, because sometimes doctors underestimate the amount of blood loss, and these females pass away because they're not able to, they bleed out too much and it gets too fast, too quick, and it's just too sudden for an action to happen, because it's once they realize that, oh my goodness, they're bleeding out and they didn't realize it earlier, these females end up passing away. And that's one of the biggest reasons why nowadays there is still a death rate in mothers who just given birth. And so she said the reason why that is such an issue is because there's not scales in every labor and delivery room. They're expensive, they're hard to find, they're very limited on that level, and so it's just they needed to be a fix to that issue. And so we decided to create a postpartum bedpan that would not only weigh the blood, but it would be attached to the bed in order to create a solution that's not only cost effective but very efficient, and then be able to hook up to every bed, because there is a standard labor and delivery bed. But the reason why we wanted to do this was because we wanted to make sure that doctors and nurses won't have to estimate the amount of blood coming out, because a lot of times they would have to estimate it without a scale, and they could underestimate and cause the mother to pass away because they missed a postpartum hemorrhage. So what we found out through our research is that there is a certain amount of milliliters counted wise as what is counted for as a postpartum hemorrhage. And so ultimately we created a pan, which you'll see here, and it has grams right here, and we found out that grams is pretty much equivalent to a milliliter. And so because you can weigh things in grams, we have a weigh boat right here that you can put inside of this pan to make it reusable. And so you'll have this on the back side of a bed. So if you imagine the bed being out this way, you can use this, and once you pull all the blood into this weigh boat, it will weigh how much blood has been lost, and then you can remove after the surgery is done. If they had postpartum hemorrhaging, if they did not, then you can just, again, remove this and have it be reusable and clean. You put another weigh boat in it. But what these hooks here are for is so that you can move it up and down underneath the bed. So imagine this still be hooked up to the bed, but you have it underneath so that you have this area to walk past when labor is not occurring. But when it is, you hook it up and you have this bed to easily scoop. So it's not only time efficient, cost efficient as well, because you have reusable, you don't have to get new ones and clean it all well. You'd clean it, but you have the weigh boat to help with that. And so that's our pan. That's the main idea that we came up with. But the pros and cons to this ultimately is it may not hook up to every labor and delivery bed, just because you may have to have a different attachment for each. There is a standard labor and delivery bed that majority of hospitals have. However, if you have an older hospital, or if you have a new hospital that has a new bed and kind of bed that we don't necessarily have the hooks to, that may be an issue, because you won't be able to hook it up to the bed, and so it won't necessarily be as time efficient because you don't have that hook to just pop it up, scoop the blood in, and have the measurements for it. Also, different points of view. Some doctors may find this is not necessary, because they may be like, oh, I've been doing this for years, I can estimate it, it's fine. However, we do believe in an overall consensus idea that we think that it is best and most beneficial to have these types of pans underneath the bed that you can pull out and properly measure the exact amount of blood that's been lost in order to help the patient, because ultimately what nurses and doctors are here for are for the patients, and to help the patient and to get the patient better, because we don't want any more death rates within mothers in early childhood, these kids not having their moms because of a mishap of undercalculating how much blood a woman has lost. And so that's ultimately all the issue, but hopefully you'll find that this is very innovative, very productive, and actually hopefully someone will patent it and make it one day in order to bring it to the real world to actually solve issues in the labor and delivery field.